Thank you. Thank you for the opportunity to present our work. I'd like to, my co-authors, whom I'd like to acknowledge, and I have no conflicts of interest to disclose. Deep surgical site infections have been associated with significant increase in the cost of care, as well as higher incidence of societal and personal costs. To minimize them, risk factors, as we just heard, have been identified and clinical pathways have been suggested. We took the approach that one can distinguish the bacterial seeding causing the infection as occurring prior to or after the skin closure. And for seedings that occur after the closure, we hypothesized that the skin closure type could play an important role in the SSI, the surgical site infection rate. However, the literature has been inconclusive. In the general surgery literature, meta-analyses have found that there were no differences in the infection rate between different skin closure methods. Those running subcuticular stitch with absorbable suture probably had better cosmesis and patient satisfaction, while skin staples resulted in shorter operative time. 2019, there's a 2019's the systemic review of an orthopedic surgery and other studies in the general orthopedic literature have been mixed. In the spine surgery, there are studies that show lower infection rates with non-suture methods when compared to staples. On the other hand, the study comparing skin staples and transdermal nylon sutures did not find differences in the deep infection rate. A recent report showed that subcuticular closure and staples had similar superficial infection rate at 30-day postoperative time period. Given the literature, it's not surprising that in a recent international survey of spine surgeons, a variety of methods were used by the spine surgeons to close the skin. While studying different wound closure techniques, we found that subcuticular sutures and staples were the two most common methods of skin closure in posterior, thoracic, and lumbar spine surgery in our spine division between 2018 and 2020. So we decided to compare the infection rates between cases closed using the subcuticular sutures and staples. And our hypothesis was that the skin closure method does not affect the deep surgical site infection rate. Inclusion criteria were age greater than 18, and posterior thoracic and lumbar spine surgeries closed using subcuticular sutures or staples. And exclusion criteria was previous infection in the same site, oncologic surgery, less than 3 months of follow-up, use of negative pressure incisional dressing, and multiple surgeries under the single anesthesia. The primary outcome was the incidence of deep surgical site infection in the two groups, and the diagnosis of the infection was made by the cultures taken in the operating room or by the primary surgeon at the time of the return to the operating room. There were 1,238 cases in the subcuticular group and 119 cases in the staples group. BMI, smoking history, diabetes history, and operative length were not different between the two groups. Previous surgeries in the same site, incidence of instrumentation and number of levels fused were greater in the subcuticular group. Intuitively, subcuticular group should have a higher risk for surgical site infection. However, the infection rate was 2.6% in the staples in the subcuticular group and was 6.7% in the staples group, and the difference was statistically significant. In order to have a more homogeneous group, we did a subgroup analysis of 3 surgeons who used subcuticular sutures and staples in the lumbar spine. There's no differences in the risk factors of BMI, smoking history, diabetes, as well as the number of levels decompressed. The operative length in the previous surgical site in the same site was greater in the subcuticular group. However, the deep infection rate was lower in the subcuticular group compared to the staples group. So our study showed the higher risk of infection in the staples group. And one possible explanation may be that there's a difference in perfusion in the skin, and there was a Weil's study in 2016 that showed that incisional skin perfusion was better with the subcuticular sutures than vertical mattresses or staples group. Thank you very much.
Thank you.